I'm Dr. Basavaraj Devarashetty. I'm the consultant gynecologist and fertility specialist, and I'm practicing at Vishvas Fertility. It's my own center in HSR layout and Marathalli in Bangalore. I did my post-graduation MD in obstetrics and gynecology from KMC Bangalore, and I was trained in United Kingdom. I was worked in as an specialist in obstetrics and gynecology in National Health Service. I did my fellowship in subfertility or reproductive medicine at St. Bartholomew's Hospital, London, United Kingdom. Today I'm going to talk to an important topic and a very common topic, what couple do experience. It is something we call unexplained subfertility. So what is unexplained? There is no reason found. Means all the things. First of all, what we say is when the couple are living together regularly and they are having regular sexual intercourse for 2 years, still they are not able to conceive. We call it as an unexplained subfertility. All the parameters what we look are all normal. We call it a checklist, like what we call one, the husband 7 parameters has to be normal, and the woman should have a regular periods, which indicate that she releases an egg. Third is they have to have a regular intercourse during that timed intercourse during the particular days. And fourth is the fallopian tubes has to be open, and fifth is a uterus and endometrial lining, the scan has to be normal. So if all the parameters are normal, we expect women to conceive in 80% of women to conceive in 1 year, and still they keep trying. 90% of the women do conceive in 2 years. So despite all the 5 things what I explained, if all the parameters are normal, they are trying for 2 years, still they are not conceived, we call it as an unexplained. It is a very frustrating situation. We do see couple have many consultation because they are not able to know why they are not conceiving despite having normal findings or normal investigations. So this is around 20-30%, I would say. 1 in 4 or 1 in 3 couple have this problem with unexplained subfertility. Why it happens, we don't know. It could be a couple of reasons. Like first of all, we don't know. Only when we do IVF, we'll come to know what is the problem. It may be the problem with the egg quality, or it may be problem with the fertilization, or it may be problem with the embryo quality, or it may be the implantation. So we really don't know why the pregnancy doesn't happen. Only when we do IVF, then in most of the cases we do find the reason for unexplained subfertility. And what can be done to it? So I think we have to go to the history, and if they are overweight, you ask them to lose weight, and if they have thyroid or blood pressure or sugar, that has to be well controlled, and they have to keep trying. Next would be again, lifestyle is very important factor. They have to reduce the weight by doing exercise and regular healthy diet. So that's also another factor. And they have to take folic acid and some antioxidant for 3 months that can help them to conceive. Still they don't conceive, we give 3 options. One is still they can keep trying naturally, any month any pregnancy could happen. And next would be to go for intrauterine insemination, what we call as an IUI, where we suggest the couple to try for at least 4 cycles of IUI. And if the woman couple are very young or not interested to go further for IVF, they can go up to even 6 cycles of IUI. Every time we do IUI, the success is around 15-20%. Means 1 in 5 women who undergoes IUI in this particular month will achieve pregnancy. And they have to keep trying, because the success is 20% only. They should not get too disappointed, and if they want to take a break in between, take a break of 1 or 2 months, and again they have to go for IUI, especially if the couple are young. So they can try up to 4 cycles and even maximum up to 6 cycles. In these 6 cycles, if there are 10 couple and 5 women do get pregnant and 5 women they don't get pregnant even with intrauterine insemination. So those who don't get pregnant with intrauterine insemination, we advise them to go for in vitro fertilization or intracytoplasmic sperm injection. It is called ICSI. So that would be the final treatment in a couple who go for ICSI. ICSI is the best treatment for unexplained subfertility. Majority, as I told you, the success in IVF is around 60%. Majority of women do conceive with IVF treatment, and if they don't conceive in IVF, and subsequently if they have frozen embryos, they do conceive with the frozen embryos. So in in summary, this is a very common problem, very frustrating for the couple, because they're not able to understand. Despite everything, they don't get pregnant. This is called unexplained. Lot of patience is required, and seek a doctor's advice, and go for the doctor advice accordingly. So that will help you to achieve a better pregnancy rate. I hope you understand clearly about this unexplained subfertility. Thank you.